Hello and welcome to my quick 10-minute blog summary for you all in my little cancer physio family of this month's blog post. We are just quickly going to we're just quickly going to go over the 5 phases of cancer rehab because I get asked a lot of questions about, when can I start cancer rehab? Isn't it only for when patients are in treatment? Is there anything that can be done kind of before we start treatment? What about after treatment is done? Is there any role for clinical support there? So I just kind of wanted to overview the kind of 5 different stages that we have here at the Cancer Physio and how clinical support can be helpful in each of those 5 phases. So this link is provided in the newsletter to this blog. Once again, I just kind of want to touch point on this idea that the reason that it's so important to understand the phase that a patient is in is that we're really trying to come with a personalized medicine-like approach. Same to how your kind of oncology pathway and treatment pathway are very personalized to your needs, to your diagnosis, to your stage, even maybe to your genetics. The rehab approach needs to be personalized as well and individualized to you. And so it's important that we kind of put you into a phase, and that might not be obviously permanent, very temporary, but the rehab plan can be personalized to you by doing that. Once again, the aims of cancer rehab is that there's this thing called symptom burden, and it is basically a variety of things, conditions and symptoms that patients can experience in any of those 5 phases. This can be anything from, chemotherapy-induced neuropathies, which I spoke to in another blog, hormone therapy side effects, which I spoke to in another blog, poor energy and fatigue, making exercise difficult, which I spoke to in another blog, side effects of chemo that make patients not very tolerant to exercise, and feeling quite flatlined, joint pain, stiffness, post-operative complications, and so on. We really speak to the diagnoses that we treat on the website, on the clinical services page, in addition to this blog, kind of re-encapsulate that for you all to see those different pre-post-operative conditions, nerve-related conditions like neuropathies and cancer, chemotherapy-induced peripheral neuropathies, but other forms of neuropathies as well. Some of those vestibular effects like dizziness and weakness and feeling off balance that can be caused from chemotherapy or radiation to the head and neck. And then, side effects of radiation and so on. So we've got a nice comprehensive list here. If you have a question or two about what is a symptom burden, what is it that we treat? So one of those first phases is the really exciting one, but the one that's probably the most underutilized. And this is the idea of prehab or prehabilitation. And this is the idea of you received a diagnosis, but you haven't yet started treatment. So in this phase, it offers a lot of opportunity for preparedness, getting that trail map before you get lost in the woods. In prehab, often treatment plans are discussed with your medical oncologist. You obtain a bit of that personalized medicine approach so you understand what might be ahead, what kind of treatments you might undergo. There's often a lot of questions in this stage. So often this is a really good time to connect and just assure that you've made really informed decisions and you feel really empowered with the decisions that you've made. So there's that sense of preparedness, knowing what's ahead, answering questions, and so on. We also know that there's a lot of research for prehab, meaning if people have the tools or the trail map ahead of time, a lot of complications can be minimized, a lot of setbacks can be reduced. So there's a lot of value in kind of getting that clinical support before you start treatment. We kind of touch point in this blog that in a prehab phase, cancer rehab support would include all of those baseline assessments: orthopedic, function, balance, your aerobic and cardiovascular health, your neurological health, sensation, and nerve health and conductivity. And that kind of gives you that picture of what you look like before treatment, which is very important so we can note any change once treatment starts. And documenting this through data can be very important for funding, for disability, medical reporting, for return to work planning, and etc. So that preparedness piece, that starting in prehab, is very powerful. Next phase, most patients are most familiar with. I think this is what people think of cancer physio. They think of treatment phase. I'm in treatment. That's when I need rehab. But this is only 2 of the 5 phases. Obviously, though, the treatment phase is the most loaded, heavy symptom burden often. Everything from joint or muscle pain, deconditioning and breathlessness, dizziness, lightheadedness, feeling blah, fatigue. Sometimes post-chemo, we'll see these drops in white blood cell called neutropenia, which can lead to complication and exercise intolerance. So there's a lot of support often needed in this phase, but there's also often sometimes fatigue. So this is where telehealth can play an amazing role in allowing that kind of continued support without really needing to leave the house. So the treatment phase offers a lot of opportunity for us to really support you with your symptom burden with some personalized rehab. I kind of go into detail into this blog about, the different types of treatment, and I have many blogs about this, whether it's managing the side effects of chemotherapy or radiation or hormone therapy, kind of talk about how there's different conditions that can arise with these different types of treatment. As a cancer rehab clinician, I can diagnose, those conditions, give you medical credibility for that, document that, and give you a rehab plan specific to those conditions. So you can learn more about whether it's hormone therapy or chemotherapy-induced neuropathies on other blogs on my site. Once again, in the treatment phase, we do those baseline tests if we haven't already done that to document change. We have a lot of time to answer questions, but most importantly, we create a personalized rehab plan specific to the conditions and the symptom burden that you're presenting with. The third phase is the recovery phase. This one is a bit of a fluid term and sometimes poses a little bit of controversy in a cancer journey because recovery can feel like it's not very real. Patients can be told they're in recovery, but psychologically they're still quite worried all the time. They're still undergoing continued screening, so that recovery feels a little fluid and misleading. But in medicine, when you have finished your major treatment pathway and some scans have shown that you've responded favorably to treatment, they call it recovery. So we're going to think of it that way. Even in recovery, patients might be starting new medications such as tamoxifen and anastrozole or other hormone therapy. So even the treatment can continue, but it's not considered to be the main treatment. So sometimes it isn't until recovery, when patients are in that phase, that slowing down and not being so busy with treatment-related appointments, that all of a sudden the side effects start slowly trickling in. Sometimes there's an intolerance to exercise and exertion that you didn't know existed. We can see a lot of symptom burden creep up in the recovery phase that wasn't there before, whether that's everything from the chemotherapy-induced neuropathies to dizziness from the vestibular neuropathies to just, once again, feeling blah, fatigue, and not really responding to trying to get your body to do anything. So you're just feeling that push, crash kind of cycling. So the recovery phase, there's a lot of opportunity for us, once again, to assess you, see what kind of symptom burden you have, and create a rehab plan specific and personalized to you and your needs. The fourth phase is the return to work phase. For some patients, this is smooth sailing. It's not a concern. They find that they don't have a lot of symptom burden and they can just return to work. For others, sometimes there's a lot of concern and confusion around what returning to work would look like and how to even approach that. We know that mostly patients really benefit from a gradual return, and this can mean modified schedule, modified work weeks, and modified duties. So you're slowly increasing your work demands over time, allowing your body to adapt. So the return to work phase is really important because as a cancer rehab clinician, we can provide medical reporting and documentation that helps support these kind of gradual return to work plans and work collaboratively with your health insurance provider, your employer, and even the CPP, Canadian Pension Service Canada, and so on, to assure that you have the support that you need for a successful return to work. Some patients will try to return to work and it's just too difficult. So then they may qualify for a long-term disability benefit. In that case, the comprehensive medical reporting is something we can do together. I do provide these kind of forms on my site for people that are eligible for CPP, Canadian Pension Plan Disability Benefit. That is something that is a really comprehensive form where we can really provide you diagnoses related to your symptom burden and really talk about, what the rehab plan is to maybe delay the return to work for a while, but know that we're at least trying to prepare you for the possibility of returning to work sometime in the coming 6 months to a year. If that's not a possibility, then we talk about, where in your symptom burden do you qualify for long-term disability and potentially not returning to work. The final phase, the fifth phase, is that active living. So active living is sometimes something that's really important to some people and not others. Sometimes it's something that people jump right into with very limited setbacks, and they just get back to running, and that's fantastic. We know active living is just related to feeling good, being mentally and physically healthy. For a lot of people, just feeling like themselves again. And once again, it isn't until sometimes patients try to go for that hike or try to go for that run that all of a sudden they realize that they have a symptom burden, that they may have some breathlessness or some poor balance or feel unsteady. They might have an abnormal heart rate response to exercise. They might have a lot of joint pain or lightheadedness or dizziness, or once again, that push crash cycling. So there can be side effects to a lot of the treatments that you underwent. And so we take this time to do some assessments, to do some testing, and once again, to provide you the rehab tools to be successful with setting some short and long-term physical goals to get back to active living. And ultimately, the goal is to make exercise a habit. And I spoke to that in a previous blog, just tips on how to change behavior and make things stick, which ultimately is a thing that we're all after, and that isn't easy to make exercise a habit. So once again, even in the active living phase, we would do those baseline assessments and document any change orthopedically, or your function, your balance, your aerobic health, your neurological states. There'd be lots of time to answer questions. You're getting that one-on-one time with an oncology, physio, and cancer exercise specialist. And you're given that personalized exercise plan or rehab plan specific to your goals and your symptom burden. So you can see that there's 5 different phases here throughout a cancer journey. Rehab can really have a really important role in each of them. So I want to thank you again for your interest in science and rehab, and thanks for watching my video. Have a good day.